Australian authorities are on high alert over a highly infectious new strain of COVID seen in the UK and now here in Australia. The emergence of the strain in Brisbane sent the city into a 3-day lockdown over the weekend and prompted the Prime Minister to convene an urgent national cabinet meeting to draw up new measures to try to stop the spread of the UK variant. Now, while welcoming the changes, some health experts question why they weren't implemented sooner. Nadia Daly has more.
Greater Brisbane will be entering a 3-day lockdown.
It is a very wise decision by the Queensland Government, by Premier Palaszczuk, to put in place the precaution she has over the next few days.
After the new highly infectious strain of COVID-19 was detected in Brisbane on Thursday, the Prime Minister called an urgent meeting of the National Cabinet.
This virus continues to write its own rules, and that means that we must continue to be adaptable in how we continue to fight it.
5 national policy measures were announced to bolster the fight against the new strain of the virus. The first step was to halve the number of international arrivals in New South Wales, WA and Queensland until February 15th.
Our main issue is to keep Australians safe and to really make sure that this particular strain is not the one that becomes circulating in Australia. The reason is because it will be much more difficult to control.
Masks will now be mandatory on all international and domestic flights.
We now know that it's an airborne virus. We know that people have actually gotten into a plane without COVID-19 and left the plane with COVID-19. That's been demonstrated repeatedly. Better late than never.
All these announcements asking people to wear masks on flights, they make perfect sense, but they're being done in the context of this new genetic variant, which sounds bizarre because to me, they were perfectly warranted for your garden variety SARS-CoV-2, which was enough to cause a pandemic.
The National Cabinet also agreed passengers from abroad will have to return a negative COVID test before embarking and after landing in Australia.
The idea that we weren't already doing this is absurd.
In terms of making sure people have a negative test before they get on board, I think that's reasonable.
Epidemiologist Nancy Baxter has welcomed the extra precautions but says a common sense approach is needed.
You do have to remember that people can continue to test positive for COVID-19 for 120 days after they have COVID-19. So I think we need to use common sense there. Obviously, we don't want people on the plane to be exposed to somebody who's contagious. But equally, it's not really fair if someone's had COVID-19, they've long since recovered, that we deny them access to coming home to Australia.
There'll also now be daily tests for hotel quarantine workers, including cleaners and the drivers who transport travellers. And aircrew will be tested weekly and must quarantine in guarded hotels.
When we look at some of the latest measures that have been put in, daily testing of quarantine staff, Victoria was doing this before the genetic variant was known about. So I cannot understand these delays.
Dr Vyom Sharma is a GP on the front line and treats patients in hotel quarantine. He's welcomed the new measures but says they've been a long time coming.
What we're doing is we're being reactive. We wait for mistakes to occur first and then several months later we amend them.
He's calling for streamlined national guidelines to replace the current state-by-state approach.
We're not thinking proactively about how this virus might spread. We don't have time to wait. With this variant that is likely much more transmissible, we can't afford to be reactive like this. We have to get ahead of the problem, not behind.
Every day we've been dealing with this pandemic, we have got better at it. We've got stronger. We've got more capable.
Despite presenting a united front on Friday, the New South Wales and WA premiers were trading barbs today.
I just urge the New South Wales government and people in New South Wales to look outside of New South Wales at what other states and territories are doing in order to crush and kill the virus. That's a better approach. The idea that somehow it's better to have the virus and then just manage it, I don't think is the correct approach.
I think as leaders, and I include myself in this, all of us can do better. We should allow each other to have input into those processes rather than just being told of the decision.
With this new strain that seems to have emerged, we can have even more confidence that we can manage this. But what's concerning me is how slow we have been to institute these changes. And if we can continue to be a bit more proactive, we can have a lot of confidence going into 2021 with the vaccines arriving.